Hey, it's Dr. Birchler. This video is really for people who are hurting, have some tough decisions to make, might be wondering if I have a bulged disc in my spine or herniated disc or something like that. It's not going to be new again. How can it change? How can I feel better? These kind of questions go through the mind. And so there's a few things I think are very important to know and understand, because they're somewhat subtle but true, and they can have a big impact on how you think, how you make decisions, what you do, what you not do, and keeping you kind of away from risky things when there may be some options, to not go that route. In particular, in our case, talking about the spine. So I'm going to show you a couple things and give you some thought processes. This is an image of an MRI of the spinal cord inside somebody's neck. So these would be the vertebrae of the neck, and these are the discs here, and this is the spinal cord. And this is how it should look. You have a spinal cord, and then you have these kind of white fluid in front and back of the spinal cord. This is a large disc herniation blown out, and it's scissor pinching the spinal cord right here. It's no good. This person probably frankly needs immediate surgical consult and probably neck surgery in a case like this. But here's the point: the thickness of the spinal cord might only be a centimeter, 10, 11, 12 millimeters, something like that. So instead of looking at this one, let's look at this here, because this also has a problem in the disc. The disc is sticking out a bit, but it's not nearly as much as that one. But it could be enough that of its own right it is causing a person pain, numbness, tingling, these kind of things, having symptoms with it. And here's the concept: if we were to change that half a millimeter, 1 millimeter, 2 millimeters, that could be the difference between chronic pain, maybe being miserable, maybe thinking, man, I need injections, or maybe I have to have neck surgery, something like that, and feeling like I'm getting better. I'm not having much problem. So a small amount of change, when the body is so intricate, so amazing. You change something half a millimeter can be the difference between life or death. Can be the difference certainly between pain and misery, and I'm doing okay now. Think of an artery supplying blood to the heart, coronary artery. The place where the blood cells go through there, kind of flows through there, might only be 3 millimeters wide, maybe less in some of them. And maybe it's 2 millimeters blocked, and person has no symptoms, carrying on with their life. And then it goes from 2 millimeters blocked to 2.5 millimeters blocked out of the 3, and there's only a tiny space left, and blood can't get through, and person, boom, heart attack, maybe they die. Life and death, half a millimeter difference, right? Now we're dealing with the spine. It's not arteries, but similar concept. Nerves aren't very big. Where they come out of the spine, they're only a couple millimeters big. Spinal cord, 10, 11 millimeters. Change something a couple millimeters, half a millimeter, 1 millimeter, can be the difference between misery and improving, and feeling like life is carrying on. So understand that you can go from severe pain, change something a small bit with enough time for the body to heal, and it might be dramatic different in terms of the person's health and experience of life. Okay? This is an MRI of somebody's lower back from the side. So you have vertebrae again. The black space would be the discs, and this is the kind of thing we frankly we see a lot of in practice. This is how it should look up here. This one's really good down here. But you got 1, 2, 3 discs that are bulged or herniated. You got some bone spurs, some things like that, degenerative discs. We see this stuff a lot. You have several bad ones. Where's it all coming from? Is you going to be able to do enough to change it? Well, frankly, maybe this one isn't. Maybe it's not that bad. Maybe there's enough space for those nerves to get down through here that doing okay. Same with this one, not good, but maybe enough space here for the nerves to get through. Maybe this one here, where it's really sticking out, really narrowing that space where the nerves are coming down. Maybe if we could change that 1 millimeter, person's pain in their hip or their leg or their groin would change enough that they can walk better, they can put weight on that, they can sleep better, those kind of things. So we might want to say, hey, there's all this stuff going on that you can see, and it may or may not be causing the symptoms. But if we can change something just 1 millimeter, if we can change something just a millimeter or so, it might be the difference between being miserable and feeling like, hey, life is getting better. I can carry on with this. I don't necessarily have to, to do something invasive. Cool thing with some of the things we do here with chiropractic, spinal disc decompression, if you can get a joint that's misaligned and you just change it a little bit with an adjustment, if you have a disc that's herniated or bulged, if we can take that part that's sticking out here, and with decompression we could draw it to the center just a little bit with the decompression, give the body enough time, the person might do much better and feel like their issue is largely manageable at that point here. So these are important concepts when you're in the thick of this, and I've been through that myself, and I've had to think through all these things. I've had people tell me I need back surgery, and I had to think through what am I going to do. Can we do some things that change it enough that I'll be able to walk again, that I'm not going to have weakness in my foot and foot drop and walk with a limp the rest of my life. I've gone through these things there, and maybe you are too. So not everybody's the same, but these are important concepts to think through, and they can give you some understanding. If we have a little bit of time, we can change things enough there. You might be able to feel quite a bit different, function quite a bit better, and we certainly want you to do the best we can. If you have questions about your case, you ask us here. We want you to get the best results, be in good communication, so you stay the course and are able to get pain-free and healthy and active again naturally.